Hello, my name is Esther Igboerika. For my scholarly project, I will be presenting on school-based asthma education program. My committee members are Dr. Crystal. She is my chair for this project. Dr. Sturr is my instructor, and my community member is Lori Bruder. Here are the outline for my project. Chapter 1: The Phenomena of Interest. Children with asthma and their parents do not effectively practice asthma self-management. These children struggle to use their inhaler correctly, maintain consistency in medication, avoid environmental trigger, and participate in safe physical activity. Asthma has negative impacts on students. Students with poor asthma control miss school due to frequent visits to the emergency room and unscheduled visits to primary care providers. Sometimes they are home because they have a rough night and they need to sleep in the morning. When these students are not in school, their learning and their academic performances are impacted. As a school nurse and a mother of 2 children with asthma, I manage these children in the school and also at home, and my own kids at home. My goal is to help these children understand their health condition. Asthma education offers children the opportunity to learn, understand, and manage their asthma symptoms. Asthma quality of life is essential in school-age children. I have seen the impact of asthma in my region and its negative effect on school-age children. Quality of life means different things to different people. For school-age children with asthma, it means preventing school absences, avoiding sleepless nights, and struggling to stay focused during class time, participating in safe physical activities, not feeling different or left out, being able to keep up with peers and friends. Asthma prevalence is significant. It is estimated that over 6 million children under the age of 18 are affected with asthma. Asthma disparity is higher among children from low-income families and communities. Also, higher hospitalization rates among Black and Hispanic is noted. The economic burden of asthma is significant. It is estimated that 5.92 billion annual expenditures for school-age children with asthma, and 14 million for missed school days per year, and 1.1 billion in loss of productivity by parents and guardians. The problem behind the burden of asthma is associated with lack of care coordination, availability of resources, and lack of asthma knowledge. The purpose of this research is to implement a school nurse-led asthma education program, and the aim is to improve the quality of life among students with asthma. The research question is, how does providing kicking asthma education affect the pediatric asthma quality of life questionnaire scores before and after the teaching tool among middle school students with diagnosis of asthma? Background. Poor asthma management can affect students, their parents, and the school district. For the students, it is reported that poor asthma management can lead to chronic absenteeism, poor academic performances. For the parents, it can lead to loss of productivity, because when these students are sick because of their asthma flare-ups and symptoms, their parents or guardians stay home with them. And decrease in productivity can also lead to loss of job for these parents. For the school district can also experience decreased funding, because California School District is funded based on average daily attendance of students. Significance and benefits. Asthma education program is beneficial. It can improve health outcomes and quality of life of students, can decrease school absenteeism, reduce healthcare expenditures, and also improve school funding. Chapter 2, Literature Review. The search history for this project includes the Cumulative Index of Nursing and Allied Health, the Chrome databases. All articles reviewed are in English language. They are peer-reviewed articles between 2015 and 2020. The keywords used included asthma education, school nurses, The phrases and Boolean operators used are school nurse and asthma education. The literature review team for this project included school nurses' role in implementing asthma program, asthma quality of care coordination, elements of school-based asthma education, and asthma program outcomes. The critique of the body of evidence. There were strengths and weaknesses found in this literature review. One of the strengths is that most of the literature review for this project were based on school nurse-led asthma education program, and the authors recommended that this approach of using school nurses for asthma education program can facilitate long-term sustainability of asthma programs in the school. The literature review primarily focused on rural and low-income populations, and this limits generalization of the research. Limitation for this project included communication between research staff, parents, and healthcare providers. In the study by Buckner et al., it shows lack of parental participation and collaboration between healthcare providers. In the study by Quarantine et al., it was noted that there were inconsistency in the teaching duration and learning materials. Also, most of the elements of asthma education program were not consistent in the study by Lobster et al. Concepts and definition. Gardner et al. Defined asthma as a chronic lung condition that is characterized by cough, wheezing, and shortness of breath. These authors defined asthma management as understanding asthma diagnosis, controlling symptoms and triggers, and adhering to medication. The Kick in Asthma Education is a self-management program that is developed by the American Lung Association for asthmatic students aged 11 to 16 years and in grades 6 to 10. The Kick in Asthma Education program uses fun and interactive approach to teach students how to manage their asthma program. The children complete 4 sections, which each section is about 45 minutes. And most of the curriculum covered for these sections include asthma pathology, symptoms, early warning signs of asthma and triggers, medication and devices, emergency signs, asthma review, self-advocacy, and problem solving. The theoretical framework used in this project is the symptom management theory. The symptom management theory was developed by the University of California, San Francisco in 1994 and is divided into 3 components: the symptom experience, symptom management strategies, and symptom outcomes. This theory can apply to this project. The symptom experience includes signs, symptoms, triggers of asthma that causes flare-ups for students with asthma. These symptoms can be identified by the students, their parents, and the school nurses. The symptom management strategies include programs designed to help the students to understand their asthma symptoms and triggers, such as school-based asthma education. The outcome includes improving the health outcome of the students and improving their quality of life. Chapter 3, Methodology. The design for this project included a convenient sample of students diagnosed with asthma in 6th grade, 7th grade, and 8th grade. And these students are between the ages of 11 to 14 years. They included male and female and all ethnic groups. The inclusion criteria include students with parental consent, students with diagnosis of asthma as reported by their primary care provider in their school file, students between the ages of 11 to 13 years, and students in 6th to 8th grade. The exclusion criteria included student with no parental consent, student with coexisting pulmonary disease, student with cognitive impairment, or mentally disabled students. The sample size for this project was 23 students were recruited for this project, but 19 students completed both the asthma education intervention, the pre and post questionnaire. Protection of human subjects. This project method were designed to minimize the risk of breach of confidentiality and feelings of cohesion. So informed consent was obtained through Maryville University. There was also oral consent that would from the school district and asset form for the participants for this project. Participants' privacy were maintained throughout the project, and the participant had the right to withdraw, refuse to participate, or ask questions at any time. There was also no adverse effect for this project. The timeline for this project implementation was between December 2021 to August 2022. The IRB application was approved in January 2022. Participant recruitment started in February 2022, although there was also several times that the recruitment was put on hold because of COVID cases in the school, but recruitment started in February 2022. The asthma education section did not take place till April 2022. And this is the table for my budget. I spent a total cost of $298 for this project. The American Lung Association provided free workbook and free chambers for this project. The instrument used for this project is the Pediatric Asthma Quality of Life Questionnaire. This questionnaire is a validated survey that measures the physical, emotional, occupational, social problems of children 17 to 17 years with asthma. It contains 23 questions that are subdivided into 3 domains: asthma symptoms, activity limitations, and emotional functions. This questionnaire is a 7-point response scale that ranges from 7 no impairment, 4 is moderate impairment, and 1 is severe impairment. The questionnaire score is obtained through the mean of all the answers to the questions. Also, the wording of each item in the questionnaire are words that children use to describe their asthma problems. The children can understand the questionnaire and answer the question based on their asthma problems. The interclass correlation coefficient for this questionnaire is 0.95 overall, and this is also consistent between each of the domains of the questionnaire. Chapter 3, Methodology. The data analysis was analyzed using Excel spreadsheet, Wisconsin sign rank test, and graphs. The information obtained for data collection sheet included the participant's number, the Kicking Asthma Education Intervention provided online, and the in-class Kicking Asthma Education Intervention. The questionnaire, the pre-test scores, and the post-test scores of the questionnaire. So all of the data collected was transcribed in an Excel spreadsheet. The Wisconsin sign rank test was used to compare the pre and post PAQLQ scores. The 3 domains of the questionnaire, the symptoms, the activity limitations, and emotional function, were categorized as ordinal data, and they were analyzed using the Wisconsin sign rank test. As you can see on the table, a significant difference was found between the pre-test and the post-test scores in the 3 domains of this questionnaire. For the symptoms, we see P is less than 0.03. For activity limitation, P is less than 0.005, and for emotional function, P is less than 0.012. The graphs shows the differences in the pre and post questionnaires after the interventions. So for activity limitation domain, we see that in the pre-test, 4 participants had severe impairments, 6 participants had mild impairments, and 9 participants had no impairments. For post-test, we see 2 participants had an impairment, 4 participants had moderate impairments, and 13 participants had no impairments. For the symptom domain of the questionnaire, we see in the pre-test, 5 participants had severe impairments, 6 participants had mild impairments, and 8 participants had no impairments. And for the post-test after the intervention, we see 3 participants had severe impairments, 4 participants had moderate impairments, and 12 participants had no impairments. Looking at the graph for the emotional functions, For the pre-test, we see one participant had no impairments, 7 participants had mild impairments, and 11 participants had no impairments. And after the intervention, 1 participant had severe impairment, 2 participants had moderate impairment, and 16 participants had no impairments. Chapter 4, Results. The setting of this project is described as school district in the western region of the United States, and this school district serve low income and medically underserved communities with increased rates of childhood asthma. Before this project, the students with asthma learn about their health condition from their parents or from their healthcare provider. Also remember that these students spend about 15 minutes with primary care providers, so this is not enough time for these students to gain knowledge of their asthma symptoms and their asthma conditions. Also, the school nurses in the school, they also help to teach inhaler technique occasionally. So this quality improvement project was the first project that is being implemented in this school district. The outcome of this project is significant. It shows the significant difference between the pre-test and the post-test of the PAQLQ questionnaire scores for the 3 domains of the questionnaire. This is with the activity limitations, the symptoms, and the emotional functions. Also, after the intervention, there was increase in the number of participants with no asthma impairment. There were barriers to this project. The COVID pandemic was a significant barrier to this project. About 4 participants did not complete the teaching intervention because of exposure to COVID, and they have to quarantine and also isolate. So although this participant had the opportunity to complete this project online, but they were not able to complete this teaching project. Other barriers to this project also include lack of comprehensive resources to implement a sustainable school-based asthma program, and also challenges in parental and staff engagement. The strength for this project is that this project is conducted in a population where there is significant negative impact of asthma. Also, one of the strengths for this project is the collaboration between the school admin, the school staff, and the parents and the healthcare provider. So this project approach will help to sustain this program in the school environment, because this communication needs to be made, letting the teacher know when the students needs to be added for their asthma sections, communicating with the administrator, putting hold on sections because of asthma exposure. So it is so crucial to have this communication between the school team. Limitation to this study is seen in the sample size. A larger sample size is needed to provide more data on the impact of asthma in this population. Also, they were missing data. Most of the participants were not able to complete this project because of the COVID-19. Again, the project outcome was measured only one. This project would benefit from extended period of time, and it's evaluating the outcomes in 6 months and to see if there's still any changes in the post-questionnaire scores. Also, there was no control for this project. It is difficult to determine whether the students that are not enrolled in this program would still have improvement in their asthma outcomes, in their symptom domain, their activity limitation, and emotional functions. The insight for this project is that this project was implemented during the end of the school year, and the timing was short to recruit more participants. The plan was to include 5 elementary schools and 2 middle schools, but this project was only conducted with 1 elementary school and 1 middle school. The program implementation would be beneficial at the beginning of the school year. This will allow the student to learn about their asthma symptoms and apply these skills throughout the school year. Implications to practice. A comprehensive and effective school-based asthma education is convenient, is accessible, and also can close the gap between asthma disparities and mobility. Care coordination and collaboration team approach are visible in implementing an effective asthma program in the school. The school nurses are the primary care providers in the school. They are act as case managers and care coordinators for students with asthma, and they also facilitate communication between parents, healthcare provider, and the school. The school nurses are in the best position to implement a school-based asthma education program. This project demonstrates that school nurses can implement school asthma education program, and this support from the school nurses can help achieve the self-management education of the National Asthma Education and Prevention Program. Implementation of school-based asthma program is cost effective and can decrease avoidable costs of asthma, as we can see that it could cause problem for the school district, decreased funding, and then for the parents, loss of productivity, and for the students, lack of loss in academic performances because they are not present. Poorly managed asthma can lead to frequent hospitalization, emergency room visit, increase in healthcare, decreased school funding, and also loss of productivity for parents. A further effort or further research can work on expanding the resources available in implementing school-based asthma education programs. The communication and coordination of school-based asthma programs, and also effective way to have more students participate in school-based asthma program. Thank you. And here are my references. Thank you.